Hi, Sarah, Laura, how are you? Well, let me
Hi, fine.
it's nice to hear you. So let me see, it's 8 and 3. Do you want to start now? Because it's a very long class today.
Yes, please.
Okay, let me share a screen and then we start. Give me a minute, please. Okay, can you watch my screen?
Yes.
Okay, let's start. We are on time. Well, you all know how the schedule. Well, today we have a long class. I mean, we are going to check huge systems. In this case, the respiratory system, the cardiovascular system, heart and circulation, of course, the urinary system, and the gastrointestinal system. So let's go. As you know, it's a general view just with some examples. But now let's go with this, the respiratory system at the beginning. Of course, we need to check the definition. And as I was telling you previously, in the previous presentations, if we get the correct written down pronunciation, I'm going to add this to the slides in order to make it easier to check this detail, okay? The respiratory system is the network of organs and tissues that help you breathe. We all know that from the med school, from high school too. So we must consider this as the most common definition. It includes your airways, lungs, and blood vessels, of course. The muscles that power your lungs are also part of the respiratory system. So we all know about it from the anatomical classes during the career, but that's for making a fast review. We must remember that all of these parts work together to move oxygen throughout the body and clean out waste gases like carbon dioxide. This system includes the nose, throat, larynx, trachea, bronchi, and lungs. Of course, as a synonym, it's also called a respiratory tract. Okay. Now we have our red friend, the red guy, who's showing us this first picture with an anatomical review, a big general view, of course, with all the details that I think are important at this point. So read this, memorize the most important parts. I think it's important to do it that way, and check the way they should be written down. Why? Because during the homework, during tests, of course, I'm going to take in count this kind of details, how we write down these names, okay? Anatomical landmarks. Here we have a very easy picture, I think, again, for checking. It's for you, self-study. And now the next rays, thorax X-rays, showing you just how to identify the structures and write down in English the name of them. Just a review, but try to memorize this, okay? Now I have this amazing chart, I think, structures and combining forms. While talking about structures and combining forms, we must consider this, all of the structures and all of the combining forms, because of the grammar details they offer to us. So doing it faster. Just check this, check how to combine the vowel. As you can see, all of them are using the O. It's easier to do that. For example, pharynx is pharyngo, or maybe larynx, laryngo, similar to Spanish, right? Trachea, tracheo, as you know, it's easy to make. About lungs, we got pneumo, pneumono, or pulmono. According to the situation, we choose the correct expression, the correct word. Please read all of this, the primary functions and the measure structures, just for making a review and catching as much vocabulary as you can. About the word parts, it's similar, of course. And we consider this broncho, bronchi or bronchio, laryngo, naso, oxy, oxy, for example, oxygen, pharyngo, phon or phono, plur or pleuro, hyperpnea, of course it's important, for apnea, for example, pneumo, pneumono, or pneum, according, pulmo, pulmono, we know, sinus, som, sphere or spiro, thorax, thoraco or thorax, trachea, tracheo or trachea. Okay, practice on this, check these details. Going to some common situations, we must consider this at the beginning. The URTI, the upper respiratory tract infection. I need a volunteer, please. What about Alejandra? Laura Peredo. Okay, perfect, Laura. Can you read this slide, please? Thank you.
Yes. An URTI is an infection of your upper respiratory tract. This includes your throat, nose, pharynx, larynx, sinuses, and trachea, windpipe. This upper portion of your airway is susceptible to many bacterial and viral infections that can cause a range of symptoms, with varying degrees of severity. Infections and airborne illnesses are easily spread by contact with other people and are often transferred by sneezing or coughing.
Thank you so much. So as you can see, very common situations. We all know about it. We all live with this all the time, right? And always remember the structures that the URTI are taking, okay? Throat, nose, pharynx, larynx, sinuses, and trachea. Easy to make. Now we have some symptoms, common symptoms, common situations. And it's easier while checking a picture. It's easy to catch the information, to memorize how it works. We got sneezing, chills, headache, sore throat, airborne infection, cough, cold, backache, snot. Okay. This kind of words are going to be useful. This kind of pictures of charts we are going to use a lot during the whole course. Talking about cough specifically, well, we must remember how it works, how is its situation, we could say, right? Alejandra, can you hear me? Alejandra Vela? Are you there?
Yes, teacher.
Thank you. Can you read this slide?
Okay, cough is a common symptom of upper respiratory tract infection. And lung disease, a cough may be productive, where the patient coughs up sputum, or non-productive, where there is no sputum. A productive cough is often described as loose and non-productive cough as dry. Sputum or phlegm may be clear or white mucoid, yellow due to the presence of pus, urine, purulent, or blood stain, as in hemoptysis.
Okay, thank you so much. So, you can see it could be productive if it gets a sputum, or non-productive if there is no sputum, nothing to leave away, right? As the slide says, the cough is very common. A very common way to describe it is as loose. I mean, patients could say, I'm coughing and with a loose. When they say I'm coughing with a loose, they are showing us that they have some sputum, they have phlegm. Okay, they are leaving some phlegm, some mucus, and in that way, it's easy to catch. It's easy to understand. If they say loose, they are leaving something. Could be phlegm, could be blood, could be anything, but they are leaving something by mouth. If they say that it's dry, of course, there is nothing. It's the opposite situation, okay? Go ahead. Okay, we are going to see some dialogues giving us some expressions, okay? I need 2 volunteers, please. Okay, Juan Octavio, can you hear me?
Yes.
Hi, Juan Octavio, please, you're gonna be the doctor, okay?
Okay.
And Rinaldi, can you hear me?
Yes, teacher.
Okay, Rinaldi, good night. You're gonna be Mr. Hamilton. Please
Night.
read this dialogue.
Okay.
Okay. How long have you had the cough?
Oh, for years,
Do you smoke?
I used to smoke heavily, but I gave up a year ago.
Do you cough up any frequently?
Yes,
What color is it?
usually yellow.
Have you ever noticed blood in it?
No.
Any problems with your breathing?
Yes, I get very short of breath. I have to stop halfway up the stairs to get my breath back.
Okay, thank you both. Thank you so much. So you can see in blackened words, we have some expressions. For example, smoke heavily. The meaning of this is the patient is smoking more than 5 cigarettes per day. Okay. I used to smoke heavily. I used to smoke a lot, extremely a lot, right? But I gave up a year ago. I gave up, I left it. I'm not smoking at this moment. To cough up. Do you cough up any phlegm? I mean, do you leave some phlegm? Do you have phlegms? Yes, the patient is with a loose during the cough, okay? It's yellow, okay. Have you ever noticed any blood? Of course, easy. Any problems with your breathing? When they ask about it, we are looking for how this pattern is working. I mean, if the patient can breathe normally or maybe has any situation that could infer a pathological situation indeed, okay? The patient says, I have to stop halfway up the stairs to get my breath back. He has to, well, he walks and stop, take a little rest, then can breathe again, and then starts walking again. Going to the blue guide, phlegm is pronounced as phlegm with an F and L. Always you see P and H together. The pronunciation sounds like an F in Spanish, okay? Phlegm, that's the way to write it down, and that's the way to pronounce this. Now, going again to the correct way to write down this information. We can say as doctors, patient's case notes, C/O, dyspnea, and cough. I mean, complaining of dyspnea and cough. How I know that the patient is suffering with dyspnea? Because of this, get my breath back. I need to stop and then breathe again, take a rest, I can breathe again normally, and then I have to go back. He has trouble while breathing. That's dyspnea, right? With this abbreviation, C and a dot means with. with purulent sputum for years, no hemoptysis. As you can see, all the information that this patient is giving us during the dialogue is resuming this bubble in these notes. That's the way we take the information from the patient. The most important parts, just in medical terms, as you can see. We are not writing complaining of cough and phlegm. No, that's not correct. Complaining of dyspnea because he needs to stop. He has problems while breathing and cough. That's the situation. That's the most important part, I think, from this slide. And we are going to practice how to write down these notes during the whole course, Module 1 and Module 2. But that's the correct way to do this, okay? Let's go ahead. Cover your mouth when you cough, just one of the most common advices we get during these times, I think, from the pandemic times, from the pandemic periods. But now it's just important to get it. Snot. This is a chart for reading by yourself, but let me explain you. When you get a cold, or you get, well, any situation in the URTI, you leave snot by your nose. That's the fluid that is coming from your nose, no matter the color. The color has a different meaning according to the situation that you are suffering from, okay? Snot is a very common situation during a flu, during a cold, I don't know, so let's take it in count. Read all of this, take the information and any expression you get on this, let me know during the workshop, okay? That's why it's for you. Now I have the phlegm. Again, the phlegm is coming from the lower respiratory tract. We all know about it. And according to the color, we can think about any situation that the patient is suffering from, right? We know it could be white, green, red, and brown. Maybe yellow, but yellow is usually translated to green or understood as green. So read this, check this, okay? It's very common to get it. And now let's go with this, a very common situation, the common cold. Everybody has the chance to live with this at least once in your life or during while we were younger, I mean. I need a volunteer, please. Someone who would like to read this slide. I'm taking in count. Never forget this. Okay. Elena Jacqueline, are you there?
Okay, I am here. The common cold. The common cold is an infection that affects your entire upper respiratory system. A virus attached to the lining of your nose or throat and triggers an immune response. This immune response results in congestion in the local area and leaves your body feeling generally run down as you try to fight it. Most colds are caused by the rhinovirus, but other culprits include influenza, parainfluenza, and coronavirus.
Thank you so much.
Okay.
Thank you. So you can see, very common situation, right? This virus attached to the lining on your nose. I mean, they are just here, the same place we were checking during the coronavirus infection. That's why we used to take the lab test from nose, from this part. That's the same place where this virus attaches and then triggers, leaves an immune response, okay? We get on congestion, run down, but according to the situation, we can ask for culprits, laboratory tests. When we take a secretion, we could say, we live into a culprit recipe. We plant this virus, this bacteria, according to the situation, and then you consider, you take care of this as a plant, as a small tree, and you are checking for 2 or 3 days, and taking in account which microorganism grows up, you could identify which one is in the body at the moment. That's a culprit. I think it's a way to understand these words. Well, symptoms of the common cold, we all know about it, but let's check the expressions. Blocked nose, sneezing, sore throat, dripping mucus from your nose. I mean, that's not stuffy feeling, and fatigue. Okay? Common expressions in order to receive information from patients. And some at-home cold remedies. So just an information slide in order to show some expressions, okay? Descongestants, just for adults, antihistaminize, salt water, NSAIDs, plenty of fluids, hot fluids, of course. Well, vapor rub, or here in Bolivia, Mentisan, yeah. Lots of rest, zinc lozenges, a great way to help our immunological system. The echinacea, and the warm bath according to the situation, okay? If it's possible to take it, it works. Let's go to one of the most important maneuvers we use during, well, in our profession, I mean, in medical activities all the time. The auscultation. The auscultation, of course, is listening to the sounds of the body during the physical exam by using the stethoscope. Easy, we all know about it. We usually auscultate lungs, heart, and intestines, okay, as the most common organs. So just for making a review and checking maybe the definition of this. We had the case of Mr. Hamilton, the dialogue that was developed by your classmates. And now the doctor is evaluating Mr. Hamilton's chest. The doctor says, take deep breaths in and out throughout your mouth. 99, I mean, repeat 99 in order to hear some details. So, oh, it's moved. Well, so while writing down our notes, to the medical history, to the report, we only go to the point. I mean, we only write down the positive findings. On exam is the meaning of OE. On exam, chest, I mean the place we had a finding, early inspiratory crackles, both lungs bases plus expiratory wheeze. So you can check. We are not describing normal findings. We are not describing non-pathological situations. Nothing like that. Only the pathological findings, of course, in medical terms, avoiding the information we don't really need at the moment. Okay? They can count this. While listening these details, this kind of information, yeah. During the auscultation with the stethoscope, well, we have these sounds, for example, crackles, which sounds like hairs being rubbed together and suggest the presence of fluid in the lungs. Okay. This link sends us to another page when we can hear the crackles. We got the wheezing, the wheezes, and more musical sounds like wrestling and indicate narrowing of the airways. Usually in asthma, we can hear wheezes. Okay. All links I'm gonna send to the WhatsApp group for you to listen to these details by your own, okay? The pleural friction rub is the sound that we hear when the surfaces of an inflamed pleura are present, okay? Again, I'm gonna send the link for you to listen to this. As you can see, the doctor was asking for Mr. Hamilton to say 99. In English, 99 is the correct expression to evaluate vocal resonance. In Spanish, you know, it's 33 or 33, right? That's the difference we're talking. While checking the vocal resonance, we evaluate if it's increased, for example, in pneumonia, or decreased as in the pneumothorax, okay? This chart is just extra information. You can read all of this at home and check the specific vocabulary, okay? Oh, okay, sorry. Well, about the broad sounds, we have this extra information. This slide that is for self-study and check the correct vocabulary, the correct way to express or to explain this. The vesicular, the normal one, bronchovesicular, bronchial, and tracheal. Duration, expiration, and location is just extra information. It's for you, but I'm showing you this vesicular, bronchovesicular, bronchial, and tracheal. Now, some abnormal breathing sounds with its characteristics and some causes that could leave this situation. We got stridor, ronchi, pleural friction rip, crackles, squawk, and wheezes. Okay? Read this extra information. It's very important because you got a list, I mean, for some situations that could leave this. Going to the respiratory patterns and causes, we have the lines we use during the career for understand how it works, how the breathing is at the moment. We have this bradypnea, tachypnea, hyperpnea, Kussmaul, hypopnea, ataxic, biot, chain stocks, air trapping, obstructive, signing, apneustic, agonal, and apnea. And you have a list of the causes that could leave us in this respiratory pattern. Please read all of this, it's very important, okay? Check the correct vocabulary and don't forget to check the way to write it down. Okay, about the pathologies of the respiratory system. Well, it's a very short chart in my opinion, but with the most important situations. For example, in lungs, we get the COPD, chronic obstructive pulmonary disease, chronic bronchitis, emphysema, asthma, acute respiratory distress syndrome, the ARDS, very common, of course, atelectasis, pulmonary edema, pulmonary embolism, pneumorrhagia, tuberculosis. About the upper respiratory diseases, upper respiratory infection, allergic rhinitis, the croup, diphtheria, epistaxis, influenza, pertussis, rhinorrhea, sinusitis. About pharynx and larynx, pharyngitis, laryngospasm, voice disorders like aphonia, dysphonia, laryngitis. Trachea and bronchi, tracheorrhagia, bronchiectasis, bronchorrhea. About the pleural cavity, we got pleurisy, pleurodynia, pleural effusion, pyothorax, empyema, hemothorax, pneumothorax. Going to pneumonia as an extra chart, I decided to divide it because we got lots of situations. Well, we can say the effect of the lung tissue, bronchopneumonia, or lobar pneumonia. According to the name of the causative agent, could be by aspiration pneumonia, bacterial pneumonia, community-acquired pneumonia, hospital-acquired pneumonia, walking pneumonia, or mycoplasma pneumonia, pneumocystis pneumonia, and viral pneumonia. The interstitial lung disease, pulmonary fibrosis. Okay, the environmental and interstitial lung disease, pneumoconiosis, anthracosis, asbestosis, and silicosis. About the genetic disorders, cystic fibrosis, lung cancer. About the lack of oxygen, airway obstruction, anoxia, hypoxia, attitude hypoxia, asphyxia or asphyxiation, cyanosis, hypercapnia, hypoxemia, respiratory failure. Well, the last one, I'm not sure. I'm going to correct this previous sending to you. This chart is just showing us how they could look like, or maybe making a memorize. Okay. Now I have the emphysema, how it is really seen. And now have the abbreviations. Very common, of course. As I was telling you, you must study this and try to take the most important, the most common. This is for you. Here we have the full term and the abbreviation, and here the same abbreviation and full term, just the opposite situation. Okay, let's go to the cardiovascular system, the heart and circulation. So let me ask. Andrea, can you hear me? Are you there?
Yeah.
Oh, okay. Hello. Please read this slide. Read this.
Okay. The circulatory system is made up of blood vessels that carry blood away from and towards the heart. Arteries carry blood away from the heart, and veins carry blood back to the heart. The circulatory system carries oxygen, nutrients, and hormones to sell and remove waste products like carbon dioxide.
Thank you. So, you know, that's the common definition, right? That's the common way to check this system. No, so let's go ahead. Now we have our first anatomical review with the red guy, of course. Let's take it in count. No. Now we have another anatomical review, just the heart. Very important in my opinion, but we got the chance to check this. Another one, another view, another position, a new position. So check all of these structures. An easy one to check the myocardium with the endocardium, myocardium, and epicardium. Okay. Now checking the valves of the heart. And now I have this slide that is just for information. I'm not going to take it from the slides to take the homework or take it during the test. It's just for reading and catching vocabulary. Okay. It's how the blood is going through the heart. So let's consider this. It's for you. A very easy chart showing how the blood is going through the body. And schematic, easy schematic picture. And now we have this anatomical review with the great veins and arteries. Just the biggest one, the most important in my opinion. Please read all of this. I know the anatomical review is so long. It's harder, but it's important to do it. More details, maybe showing extra information is for you for making a proper anatomical review. As you can see, it's basic. Now it has more details, just arteries in this case. More details with arteries is for you, for making a comparison maybe with the previous and this one. But check, of course, we need to read a lot. Okay, now we are here. Again, the chart that we are showing every day. Let me call someone. Diana, can you hear me?
Hi, yes.
Hi, can you read the major structure and the related combining forms, please?
Yes.
Thank you.
Card, related combination forms, card and cardi. Primary functions, no, right?
No. At this point, it's not necessary.
Okay. Blood vessels, Angie or vas. Arteries, artery. Capillaries, capil. Veins, fleb or vein. Blood, hem or emat.
Okay, thank you so much. As you can see, the combining form, the vowel we usually use is the O, so it's possible to make it. Let's keep on working. Now we have again the word parts with its meanings. Angi, aort, aorto, arterio, ater, brady, and a hyphen, it's a prefix. Cardio, cardio, crasha, you know, it's a suffix. Emia, it's a suffix again. Erythro, hemato, leuco, flevo, tachy as a prefix. Thrombo and vein. Okay, just for studying and catching the meanings. Now we have this, I'm sorry, it's too big, the picture, I didn't check it, but it is the shortness of breath. Shortness of breath is one of the most common symptoms when we get a cardiovascular disease, okay? As a synonyms, we can say shortness of breath or breathlessness or dyspnea. 3 ways to describe the same symptom, the same meaning, just the way to give the information. At first, it is caused by exertion, physical activity such as climbing stairs. I mean, a huge effort. But in severe cases, it may be present even at rest. A patient who's breathless when lying flat, I mean orthopnea, for example, in bed, will tend to sleep raised up on 2 or more pillows. The abbreviation SOBO stands for shortness of breath on exercise, or on exertion, or on effort. If you read an article, a report from a colleague or something like that, you read SOBO, you know that this shortness of breath on exertion, okay? So let's take in count. Patients say, I get terribly short of breath climbing the stairs. I mean, while going upstairs, I feel I have some problems for breathing. I feel short of breath. I cannot breathe normally as the rest of the people. So let's take this detail in count. Okay, considering the heart rhythm, we might take in count this detail. We have the chance to read the vital signs in 3 different ways. For example, looking at this, the normal resting heart rate is 65 to 75 beats per minute, abbreviation BPM, usually in parentheses, okay? In athletes, it may be as low as 40 beats per minute. You know, we can write down in our report the full term or the abbreviation. In extreme athletic activity, the heart rate can go as high as 200 beats per minute. That's the meaning of this word, of this slash line. I mean, if you see this, you know that this is the meaning, okay? Slash and mean. The heart rate may also be regular or irregular. So let's take this in count. Well, now I have some details, extra information for showing you some sounds, but it's for practicing. And now I have this. In an irregular rhythm, arrhythmia, there may be early beats which interrupt the regular rhythm, premature beats, or the rhythm may vary with respiration, or it may be completely irregular as in fibrillation. When patients are aware of irregularity, they describe the symptom as palpitations. Okay, so let's take this into account. Okay, now we have the chance to check this clinical case when we are the doctor and we are evaluating a patient. And the report says, let me see. Dorian, can you hear me? Are you there?
Yeah, here.
Okay, can you read this slide, please?
Sure.
Thank you.
Clinical case. A 22-year-old student was admitted to hospital with a long history of heart problems. He had been increasingly tired with shortness of breath on exertion, orthopnea, palpitations. It is
I'm sorry.
it is mitral or mitral valve. Mitral valve replacement had been carried out 3 years previously, and this had established the symptoms of heart failure, but was followed by episodes or attacks of atrial fibrillation, which had been particularly severe for the 6 months before admission.
Okay, thank you so much. Thank you, Dorian. There are some words, for example, stabilized. When you are with a patient and you have a situation, a pathological situation that is getting as a problem to the patient, you stabilized this with your treatment. You correct the pathological situation with the treatment, okay? Then when we say admission, it means when the patient gets into the hospital because of pathological situation. I mean, the patient has to stay in a room, in a bed. The patient has to be evaluated by some specialist maybe, and you stay there as many days as you need, receiving fluids, treatment, eating, and taking the control of everything. Okay. Now, well, this chart is for showing us some details. As a resume, we can say, because the symptoms, the common symptoms, are present here in order to help to identify these pathological situations, right? We got the shortness of breath, the chest pain, nausea or vomiting, anxiety, sweating, and dizziness. And of course, the heart attack. Then we got this pathological situation, the heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output. The amount of blood pumped by the heart each minute or the body's needs, it may be involved the left side of the heart, the right side, or both. Okay, easy to catch. We got this pathological definition during the career, and I'm sure that everybody that is a doctor now had the chance to check this situation that could be so sad to a patient, right? Yeah. I'm sorry. Well, in this chart, just for making a review, we must remember in left heart failure, the main symptom is breathlessness, the shortness of breath in the left heart failure. The chart, the pictures is just for showing us how the physiopathology is going on with this. Check this, read this, and if that's any question, tomorrow we solve it during the workshop. Then we have the right-sided heart failure, when the main complaint could be the peripheral edema, the swelling. The swelling is one of the most common situations that is described at this point. Okay. Okay, the symptoms of the heart failure or the right heart failure includes peripheral edema, the swelling, beginning in the feet and ankles. This is known as feet edema. Okay. When a finger is pushed into the swelling, it causes a small depression or pit. You are going to see these structures, these situations later, okay? Okay, about the examination of the heart and circulatory system, we must consider that they are present in all parts of the body. We have some maneuvers and specific places to check. For example, look at the lips, tongue, and nails for the blue decoloration. It means cyanosis, of course. Cyanosis may be central, like this, or peripheral, like this, just hands, right? Talking about the heart failure, we must remember the order of the maneuvers we use. At the beginning, the inspection. We inspect the hands looking for clubbing. Clubbing is this shape of the nails, this shape of the fingers. That is clubbing. In español, we say dedos en palillo de tambor. In English, it is clubbing. The clubbing is one of the most common symptoms we can find it. And well, that's how we can consider how to evaluate the pulse, okay? Feel the radial pulse at the wrist and note the rate, for example, 70 per minute. And rhythm, regular or irregular in force, as well as time, okay? In this chart, are checking the most common arteries, similar to the previous one. These places are for taking the pulse, okay? So let's consider this. We evaluate the rhythm, if it's regular or irregular. We evaluate if it's irregular. We must take the value in a full minute. About the measure of the blood pressure, about the BP, and assess the jugular venous pressure, the JBP. Let's consider this. Let's take in account that we must consider this activity as a basis of the evaluation. Then we have to palpate. Okay, we palpate the chest for the apex beat. The normal position is in the fifth, the left intercostal space, 1 centimeter medial to the mid-clavicular line. We all know about it, where to find or where to palpate in order to feel the beats. Heart size may be measured by percussion. We all know. We have the maneuver, we place hands, and we make the sound. If you are well trained, you might have the chance to do this diagnosis. Okay, it's normal. It's normal to check, maybe to work with a partner and And find these anatomical landmarks. While auscultating, we must feel for any trills, any sounds, listen for murmurs and other abnormal sounds. For example, the friction rubs or the beginning of mitral area. Murmurs may be soft or loud. A harsh murmur is loud and rough. I didn't find during the preparation of the slides a website showing these sounds, but we get an idea, right? During the med school, we had the chance to evaluate all of this. Now we have an acronyms. When we can say abdomen, I mean aortic valve, pulmonary valve, Eros point, tricuspid valve, and mitral valve. That's the order we should evaluate our patients in order to get all the information we really need. Now some pathologies, pathological situations, right? Talking about the system, I decided to divide the situations according to the structures that are damaged. For example, the heart. We got congenital heart defects, coronary artery disease, atherosclerosis, ischemic heart disease, myocardial infarction, heart failure, carditis, cardiomyopathy, heart valves, cardiac arrest and arrhythmia, atrial and ventricular fibrillation. Going to the blood vessels abnormalities, we can call vasculitis, angiostenosis, hemangioma, hypopnea. Well, that's the biggest situation, right? Going to arteries, we can say aneurysm, arteriosclerosis, arteriostenosis. About veins, chronic venous insufficiency of the bodies. Another one are the thrombosis and embolisms, thrombotic occlusion, coronary thrombosis, deep vein thrombosis. And then we got the peripheral vascular diseases, peripheral arterial occlusive disease, and Raynaud's disease. Then we got the peripheral vascular disease, peripheral arterial occlusive disease, and Raynaud's disease. Then we get the hypertension, the essential hypertension, secondary hypertension, malignant hypertension, hypotension, or orthostatic hypotension, okay? Very general view, I think. Now we get the abbreviations for you to study, to check. Of course, we are going to practice with some of them. And now let's go to the urinary system. I'm gonna ask someone. Laura Yawita, can you hear me?
Yes, I can hear.
Can you read this slide, please?
Okay. The urinary system's function is to filter blood and create urine as a waste byproduct. The organs and of the urinary system include the kidneys, renal pelvis, ureters, bladder, and urethra.
Okay, perfect. Thank you. So you can see in this anatomical review a very easy chart, very small in order to check, to make the most important parts, okay? It's for you. More anatomical reviews. More anatomical reviews. Okay. So check this, check the bladder, check all the structures that are here and are possible to find with common situations. Then we have this cross section that is showing us the formation of the and they're going to show you the structures, all the positions of everything. So let's take this in count. Again, we have this chart showing us the biggest details. Pablo, can you hear me?
Yes.
Pablo?
Sorry, there was a problem with my audio.
Okay, now is that possible for you to read the major structure and related combining form?
Yeah.
Perfect.
So,
Go ahead.
major structures. Kidneys, related combining forms, nephro or renal. Renal pelvis, pyelo. Urine, uro, urine, urino. Ureters, ureter or uretero, I think. Urinary bladder, cyst or cysto. Urethra, uret or urethro. Prostate or prostate. Just that, right?
Okay, thank you. That's great. So you can see all of the structures and the urine is waste product, right? It's necessary to talk about a little bit of this. Then we get this, the word parts again, the hypenencele, cyst or cystole, dia, and well, with the hypen is a prefix, the suffix ectasis, glomerulo, lit or lito, the suffix lysis, the nephro, suffix pexi, then pielo, suffix trepsi. Then we got uro, uretro, urea. Easy to catch, right? Possible to make it. Now we have this second dialogue. I need 2 volunteers, please. 2 people for reading this dialogue. No one.
I can help you.
Perfect. You could, Laura and Diana. Yes, you vote.
Yes.
Laura, are you there?
Which
You
one
will-
start?
I am here.
Laura Perez, you were raising your hand. You vote, please. Diana, you are the doctor, and Laura, you are Mr. Jones.
Okay. Are you having any trouble with your waterworks?
Well, I do seem to have to go to the toilet more often than I used to.
How often is that?
It depends, but sometimes it's every hour or even more often.
What about at night? Do you have to get up at night?
Yes, nearly always 2 or 3 times.
Do you get any burning or pain when you pass water?
No, not usually.
Do you have any trouble getting started?
No,
Is this stream normal? I mean, is there still a good strong flow?
perhaps not quite so good as it used to be.
Do you ever lose control of your bladder? Any leaking or dribbling?
Well, perhaps a little dribbling from time to time.
Have you ever passed blood in? I can see what it say
In the urine.
in the urine. It's just that I can see for
Yeah,
the.
don't worry
Sorry.
about it.
No, never.
Okay, thank you both. Thank you so much. Let's check some expressions that are in black and words. Of course, go to the toilet, similar to Spanish, okay? Are you having any trouble with your waterworks? When we say waterworks, I mean when you go to the bath to pee, that's waterworks. That moments when you really need to go and leave this urine, okay? It depends on the more often. What about night? Do you have to get up at night? Do you have to wake up and go to the bath? That's another way to make the same questions, could be. Do you get any burning or pain? Of course, when you pass water. Do you remember in the first presentation, we had a chance to check a slide when we were talking about noun, ending, well, some details. That was the last slide from the first presentation. And one expression was pass urine, pass water. It's the same when you go to pee. Pass water is the common way to talk to patients without being offensive. It's a very kind way to ask about that action, we can say, okay? Is the stream normal? When we talk about the stream, we consider that according to the stream, we can infer on pathological situation if it's changing, right? The same with the flow. If both of them change, we can infer that something is making an obstruction, making occlusion of the urethra, and well, it could change because of that. Do you ever lose control of your bladder? Do you ever lose control? Is if you can stand the pee, the urine, without leaving, without having a leaking or dribbling. I mean, that uncomfortable situation when you cannot stand the urine in the bladder, and then you pass urine, you pass water at any moment. It's very common, the dribbling and leaking in women who had deliveries, right? Who had babies in the normal, by the natural process. And they don't prepare themselves, they don't make exercise to get back again the control, the leaking and dribbling, okay? The same, have you ever passed blood? Have you ever leave blood? Have you ever noticed blood in the urine? That's the meaning of passed blood, okay? Well, the common symptoms that we always have to check while evaluating the urinary system are this: frequency, dysuria, nocturia, urgency, hesitancy or hesitancy, urinary incontinence, and hematuria. Of course, we know the meanings during the med school, during the career. For example, urgency, the urgent needs to pass urine. Sometimes you feel that situation and you cannot stand. Sometimes it's painful to stay and try to wait a little bit to stand this detail, we could say, okay? Check these symptoms, study all of them, because it comes in homework, okay? About the common symptoms about a urinary tract infection, we can check muddy urine when it's not clear as we expect. It could be a little bit different. Blood in the urine, frequent urination, abdominal pain, bad smell of urine, fever, feeling unwell, and burning when urinating. Very common, right? So that's the correct way to express about them. One of the most important situations we take in account is the urinalysis, or the analysis of urine, right? Is that simple screening test of the urine are carried out with reagent strips. I mean, we got the sample of urine like this, and we introduce the reagent strips, and according to the color, we can check how acid is that, right? More detailed tests are carried out in a laboratory of a specimen of urine. This is the specimen of urine. We take a little bit of this and we evaluate in detail. Typical specimens are midstream specimen of urine, MSU, and a catheter specimen of urine, CSU. I mean, the typical specimens, the typical sample of urine is taken in the midstream or by a catheter, right? Microscopic examination may reveal the presence of blood or red blood cells, pus cells or casts. Casts are that small stones, okay, are solid bodies formed by proteinous cells. They are so painful while living, but well, it happens. It's possible to check its structures with the microscope. Plus signs are used in case notes to indicate abnormal findings. I mean, 1 plus, a small amount, and it is described as a trace. For a large amount, we use 3 pluses. For words, they could be described as gross or marked, okay, like synonyms. When there is nothing, the sample of urine is normal, there is no pathological situation, the word nil is common. I mean, urine, 2 dots, nil, okay? Nothing to say about it, it means. The urinary tract infection, when we get, well, according to the place that is infected, here we have the name, how to write it down. For example, the pyelonephritis, the kidney infection, or the ureter infection, or cystitis, or maybe the urethritis, very common, or the prostatitis in male, very common too. Okay, just for showing you this detail. And now we got the pathological situations, right? Please check all of this. Consider this information in order to take the correct way of the classification and the way that they are written down. For example, checking the urinary bladder, we got cystolgia, cystocellae, interstitial cystitis, vesicovaginal fistula, neurogenic bladder, okay? It's just an example. Please read all of this, take it in count. Now the abbreviations is for you, of course. We're going to study on this during homework and final tests. So keep on reading, keep on practicing. Maybe with flashcards, it's going to be easier to memorize some of them, or make your own list to practice and have in mind how abbreviations are written down. Let's go to the gastrointestinal tract. So we all know about it. This system is compounded by the organs that food and liquids travel through when they are swallowed, digested, absorbed, and leave the body as feces. These organs include mouth, pharynx or throat, esophagus, stomach, small intestine, large intestine, rectum, and anus, as a general view, of course. Another anatomical, well, picture with anatomical landmarks. Check all of this. For example, we got the liver and its function. We have the pancreas and its functions. We got the stomach and its functions. Read all of this, it's for you. It's homework, okay? Self-study. Parts of the body about the oral cavity. We all know about it. Consider this. We all know how to check, how to call this. Again, the stomach with detail, I mean, these structures are so important to evaluate. Then we get the accessory digestive organs in order to make the complement of the system. Then we have the abdomen with its divisions, making the European and the American divisions of this. So, extra information. And now we get the structures and combining forms, okay? Let me call someone. Rinaldi, can you hear me?
Yes, teacher.
Please, can you read the major structure and the related combining form, please?
Okay. Mouth or oro, stomach, pharynx, pharyngo, esophagus, esophago, stomach, gastro, small intestine, entero, large intestine, colon, rectum and anus, ano, recto, liver, hepato, gallbladder. I can read. I can
Okay,
see.
I'm sorry. I don't know what I pushed. Rectum and anus, liver, what? Rinaldi, can you hear me?
Yes, teacher. Gallbladder, I can see related combining because
Oh,
I have an image.
oh, an image.
See,
Okay, the gallbladder, cholecyst or cholecysto. And then
oh,
we get pancreas and pancreato. Let me see which. Can you watch it now?
no, teacher.
Okay, don't worry. Don't worry. You're going to receive this. I don't know what happened with this. Well, with the gallbladder, we have cholecysto, and the pancreas, pancreato. Okay? Thank you, Rinaldi.
You,
Talking
teacher.
about the word parts, we consider the an or ano, cholecysto again, colon or colono, hypenemesis, entero, esophago, gastro, hepato, hypenlithiasis, hypenpepsia, hypenphagia, procto, recto, and sigmoidal, right? Just for making a review and checking the suffixes and the prefixes, the commonest ones, okay? Now we have the evaluation of the abdomen, how we examine this. We all know we have the maneuvers, inspection, auscultation, palpation, and percussion. It's just a fast view of this, okay? Talking about the general inspection, we note if the abdomen is distended, if it's bigger by fluids or gas, right? During the auscultation, we listen for vowel sounds, intestine sounds, okay? Then we make the percussion and we can identify it, for example, the presence of fluids, and we can confirm this by its shifting dullness, to percuss. Here we describe how to develop a maneuver. We all know how to do this. The patient must be lying in supine position and flat or tilt back. And then we ask the patient to move to a side and percuss again. If the fluid is present, the dull nose heard on percussion moves. The fluid gets displaced when the patient moves to a side. Then we palpate each region. It's your choice if you go with 4 quadrants or 9 quadrants. Everyone chooses the best school. And then we evaluate the tenderness, the pain when touching, or masses, enlargement of a tissue of an organ. And we must check if there is guarding or rigidity, okay? According to these findings, we got the chance to infer the diagnosis of the patient, okay? Wording may be due to tenderness or anxiety. The way to reduce this is persuade to relax the patient or maybe distract the attention while talking about something different. Rigidity, on the other hand, is constant and is due to peritoneal irritation. Rebound tenderness is in pain when the palpating hand is suddenly removed. We all know that it's a sign of peritonitis, inflammation of the peritoneum, right? Just for considering this. Going to one of the most common situations that we usually avoid is talking about feces, about stools, okay? That's why we must consider this slide. There are several words for feces. We as doctors, we can say, there was blood in the stools. There was blood in the feces, for example. Or we can ask for, have you passed black stools? Have you passed black feces? Patients could say, my motions have been very loose lately. My motions, the intestine movements, okay? Talking about the bowel movement, we can say, we can refer about defecation. Have your bowels moved today? Have you go to the bath and defecate today? Have you had bowel movement today? Have you go to, well, to the bath today? About the bowel habit, the medical expression is meaning the pattern of defecation, very important. Have you noticed any change in your bowel habit? Have you ever noticed changes in the feces, in the structure of your feces? Or how often do you open your bowels? How often do you go to the bath? How often do you leave feces, okay? Are you going to the toilet more often than normal? Are you going to the bath? Are you open your bowels more often than normal? Could be an example, okay? Of course, in medicine, we have lots of scales, a lot for everything. And talking about feces is not an exception. We got the Bristol stool form scale. Stool is the medical term, the proper term to talk about feces, to talk about this situation, right? To talk about feces. Patients could talk to us and tell us, I have yellow feces, okay? Patient has yellow stools, okay? All of these types are just for information for you, for making it easier, but we must consider that according to the type, according how it works, we can talk about constipation, hard infrequent stools, or on the other hand, the opposite situation, diarrhea. Frequent soft or liquid stools, okay? Normal stools are brown in color and semi-solid or formed. When we say formed, we refer to both of these structures. The consistency or degree of hardness and softness can be shown in this scale. This scale is giving us these details, okay? Now, taking into account the color is giving us some details about the diagnosis and how it works. Okay, it can vary, of course, and it can go from white or light colored to black. Lots of color to consider, right? So Melen stools are often described as terry, like tar. The black sticky substance that is used in rose making, or the cream we use for polishing our shoes, that's terry. The stools may be red when fresh blood is present. Of course, blood can only be detected with a special test that is called fecal occult blood, FOB. That's the abbreviation, lots of things with abbreviation similar to Spanish. When there is a high fat content, the stools are pale, are clear, and are sometimes described as clay-colored, or light-colored, or yellow-colored, right? Stools are large in volume, are described as bulky. If the patient goes to bath and says, I got bulky stools, you know that they are a lot. And about the smell is described as foul or offensive. Both of them are correct. Well, this patient has full stools, for example, because the smell is so nasty, okay? So let's take it in count. Now, pathologies, you got this chance. I divided it in the oral cavity, esophagus, stomach, and the intestinal disorders. Take all of this in count, read all of this. It's just a general view, not too high. Then we are taking in count the liver and the infectious diseases and the rectal disorders that are so small. That's why I didn't write them down. Again, abbreviations for the digestive system. Consider this, it's very important. And the best advice, let's read. Please, let's read. I know it's a lot of information. This presentation is too high, it's very long, but we really need to do this, okay? So let me send you the poll to take attendance. Okay, it's done. Please fill the poll. While you are filling this, I'm gonna send to the WhatsApp, to the chat, the presentation. Okay, I'm sending this. Please let me know as soon as you download it, okay? It's updating. Okay. Please, in the chat, let me know that you got the slides, okay? I need one student more. Is there someone who's not feeling the pool? Can you all watch the pool? Or anybody has a problem while watching this? Hello? I have 10 from 11 people to fill this. Thank you, Pablo. Did you fill the pool? Okay, thank you. The ones who fill the pool and download the slides can leave the Zoom session. Okay, that's okay. And tomorrow we are going to have the workshop. Please check the slides, read the information. If you're not reading this, there is no reason to send the slides to the group. Okay, check this, read this. Okay. What else working? Okay, good night. Thank you. Okay, thank you. Okay, see you tomorrow. Thank you so much. Thank you for being here. So let's meet tomorrow. And, I'm here. Okay, Elena and Sarah, I'm gonna close this, okay? Everything is done at the moment. Oh.